Namaskar. We would like to welcome you all on behalf of Independent Research Ethics Society, AYUSH SAMRIDDHI International Webinar Series at the milestone of 2667. Thank you. Thank you very much for joining. And I am really overwhelmed with the dedication of our today's speaker, Professor Arshia Sultan. I communicate my best regards to Dr. Arshia Sultana. Dr. Arshia, after being in her religion also, so she has accepted our proposal and she is with us today. She is excellent orator. Professor Arshia Sultana, Department of Gynecology and Obstetrics, National Institute of Unani Medicine. Welcome, madam. Welcome, really welcome.
Thank you, sir.
And I am really grateful to come for conducting these researches. Without wasting much time, this subject is new for everybody. In our Ayurveda, it is not common. So definitely it is unique subject and it is beneficial for every doctor in Ayurveda also and Unani also. So I congratulate Dr. Arshia for selecting this topic and I welcome her. Welcome. 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 You can start.
Good evening to all of you. I'm thankful to sir for giving this opportunity to join with Ayurveda Sister Department. I like to share my PPT with you all. Just inform me if you are the PPTs.
Yes, you can share.
Yeah. Can you see my PPT, sir?
It is going to be started. Yes. Yes.
So without wasting the time, I will start. Today's topic is Hirudotherapy, a natural solution for endometriosis related pain and inflammation. So the main target here in endometriosis, the most common symptoms the patient come to you is with pain. So here, how this leech therapy works in endometriosis, we are going to see. So chronic pain is not all about the body. It is not all about the brain. It is everything. Target everything, take back your life. So that's why we have to treat pain. So with this, my learning objective will be to understand endometriosis, its symptoms and its impact on reproductive system, to identify the mechanism of pain and inflammation in endometriosis, discuss the mechanism of action of leech therapy in endometriosis, and to evaluate the effectiveness of Unani treatment in decreasing pain and managing endometriosis symptoms. So, as we all know, endometriosis is a complex disorder in women of reproductive age. It is characterized by the presence of extrauterine endometrial tissue, pelvic pain, dysmenorrhea, and infertility. So, whatever the clinic the gynecologist sees, usually the patient will present with pelvic pain, dysmenorrhea, or infertility. So, the main symptoms in endometriosis is pelvic pain, dysmenorrhea, and infertility. So, endometriosis is chronic neuroinflammatory condition estimated to affect 6 to 10% of women of reproductive age. So here you have to remember that it is a neuroinflammatory condition. So here the nerves are also getting involved, and how a leech therapy will work in endometriosis we are going to see. Epidemiological studies report that women with endometriosis lesions are at high risk of developing ovarian and breast cancer, melanoma, asthma, rheumatoid arthritis, and cardiovascular disease. So 1 minute, sir. So here, with this, let us see what's happening in the endometriosis. In endometriosis, there is inflammation, neoangiogenesis, and proliferation of endometric implants due to increase in pro-inflammatory cytokines and growth factors in the peritoneal cavity of women with endometriosis. So we see, as I said you, 1 in 10 women suffers from endometriosis, and worldwide, more than 170 million women are reported to suffer from endometriosis. And most of them are not diagnosed. They are underdiagnosed and undertreated. As also, the prevalence of endometriosis in India is, we see around 26 million in India reported to have endometriosis between the age of 18 to 35. 5% of girls below 18 who complain of dysmenorrhea are also affected by endometriosis. So we cannot neglect girls who are less than 18 also. We have to exclude that these girls are not having any endometriosis. The incidence of infertility in endometriosis ranges from 20% to 50%. That means half of the patients may present with endometriosis. Various studies conducted in India population have shown the incidence of endometriosis ranges from 34 to 48% as diagnosed by laparoscopy. So, we are seeing that the incidence of endometriosis is increasing day by day, and that 50% of infertile women may come to you with history of endometriosis. So risk factors, as we all know, the risk factors can be prolonged labor, cesarean section, endometrial biopsy, hysteroscopy, uterine curettage, early menarche, late menopause, short menstrual cycles, prolonged menstruation, and again age, race, genetics, environmental toxin, pregnancy history is also important risk factor for endometriosis. As I said you already, the prevalence of symptoms can, as I said you, it can be seen in 25 to 40% or 50% of infertile women. Women may present with 40 to 60% of menstrual cramps, 70% may complain of pelvic pain, and as it is more common in ethnic group also. So symptoms, you have to remember 70s of the symptoms which are seen in endometriosis. They are dysmenorrhea, dyspareunia, dysuria, dyschexia, dysfunctional uterine bleeding, difficulty in conception, and diffuse abdominal pain. Simply, we can remember endometriosis with 7Ds. Not only dysmenorrhea, dyspareunia is more common. We see that women may come with history of fatigue and depression also. So we are going to present some case discussion where the patient was having severe depression because of endometriosis. How to go for differential diagnosis? Just remember 7Ds. You have to remember 7Ds. Along with 7Ds, what are the differential diagnoses for endometriosis? The woman can present with pelvic inflammatory disease, irritable bowel syndrome, intestinal cystitis, pelvic adhesions, ovarian cyst, and uterine malformation. So whenever the patient comes with 7Ds, you have to exclude other causes of diseases in reproductive age. Then counseling of women with symptoms suggestive of endometrium is recommended, and the treatment with adequate analgesia, combined hormonal contraceptive, or progesterone is suggested in conventional medicine. So here, as soon as the patient comes to you with history of endometriosis, what we do? We go for history taking. Then the patient is sent for scanning to check the patient is having ovarian endometriosis or other type of endometriosis. Then we say the patient to maintain pain diary, and the patient is advised cyclical oral contraceptives, or if she is not responding, we change the oral contraceptives to different progesterones, and if suppose she is not responding, we may have to go for laparoscopic treatment. So here, when it comes to multimodal treatment strategy or integrative strategy, we see that first we try with hormonal treatment, we give surgery, then we can go for other therapies like pain management with analgesics, yoga, relaxing exercises, tent, or physiotherapy, osteopathy, nutrition and psychotherapy, or complex therapy. So we see that usually, initially, the GP or private or gynecologist will treat with hormone or surgery. Then afterwards, we can, usually when the patient is not getting response, then they go for alternative system of medicine, where they go for pain management by TENS, that is physiotherapy or nutrition. So conservative treatment like hormone therapy can have side effects including mood changes, weight gain, and decreased bone density. Surgical management, though effective, carries risks such as infertility, scarring, and infection. So what the women are doing nowadays, we see that alternative therapies for endometriosis offer symptom relief but lack extensive clinical evidence. Unani medicine provides a holistic approach to treating a range of health issues, including gynecological disorders such as endometriosis. So here, traditional therapies like leech therapy are integral part of the system and are known for their efficacy in treating various diseases. So we see that already in osteoarthritis, varicose veins, and other diseases, we are using medicinal leech therapy. Likewise, we can use this leech therapy in endometriosis also. So we didn't have so many clinical evidence or studies to show that the leash therapy is useful in gynecology. There are only very few studies where the leash therapy has been used in perimetritis, that is endometritis or mastitis or genital endometriosis. But we can see that all the studies are very old. We don't have any new study showing that leash therapy is useful in uh, endometriosis. So with this, what we did, we tried to see what is the effect of leash therapy in endometriosis. So we have taken some 5 cases, 6 cases with different ovarian endometriosis and with the complaint of pain. So when all I want to present this case presentation, when all doors get closed with nothing left to hope, a gleam of light comes from heaven as a ray of hope for a new beginning to unfold. So with this target, I started doing leash therapy in our own institute where we are getting good response to the patient. So this was a 40 years old with para 2 L2, non-tubectomized, visited OPD with history of severe dysmenorrhea since 1 year and heavy menstrual bleeding since 2 to 3 months. She had bilateral ovarian endometriotic cyst. She didn't want it to go for conventional therapy. Directly she came to us as soon as it was deducted in scanning. So we did an examination and CA125 was normal for her, but the scan showed bilateral endometriotic cyst. So before coming here, she was having bilateral endometriotic cyst with severe dysmenorrhea and heavy menstrual bleeding. So we have started giving her leash therapy. Along with leash therapy, we have given Unani oral medications also and purgation also. After giving purgation, we started leash therapy for this patient. So after doing that, we saw that there was thickening in the right fallopian tube also. But after treatment, we were able to see that the endometriotic cyst has decreased in size. But important thing what we observed was the patient was free of pain. In second cycle, in second or third sitting itself, the patient was not feeling any dysmenorrhea. And after 1 year, we called her. She said, "I don't have any complaint. My menstrual cycle is normal. I don't have any heavy periods, and moreover, I don't have dysmenorrhea also." So by single giving, we gave leash therapy again. According to person, it was varying how much how many times we have to give, how many sittings we have to give. It was for every patient we have not given the same sittings. It was different for different patients. So in this patient, we gave 7 to 8 sittings and the patient responded. Again, we have given Unani medication for local application as well as oral. The patient responded in this case. So after 1 year, we called the patient to just check what is her symptoms. Though the endometriotic cysts were there, they were very small without any symptoms. So here the patient represented with abnormal uterine bleeding. Patients with endometriosis typically have more frequent and higher volumes of menstrual flow, shorter menstrual cycle intervals, and increased endometrial fragments in the peritoneal cavity. Once the endometrial debris become ectopic, adhesions need to occur in order to initiate the development of lesions and the induction of endometriosis. So why mainly they will have heavy menstrual period because of inflammation there. While the mechanism underlying this process remain unclear, it is considered that immune dysfunction and the subsequent inability to effectively clear these fragments enables endometrial lesions to form in the peritoneal cavity. Second case, she was a case of 35 years, para 2 L2, non-tubectomized, visited her OPD on 15th March 2024 with history of pain in abdomen. She was especially having pelvic pain, not only dysmenorrhea, but she was having vague pain anytime in between the menstrual period also, with history of bloating, history of depression. She was having severe depression. She tried for suicidal attempt 2 to 3 times, and she had a very large right ovarian hemorrhagic cyst, which was diagnosed as endometriotic cyst. And when she came to us, at the time of premenstrually, 1 or 2 days before menses, she has to have severe pain around 8 to 9 with history of vomitings and nausea. Patient underwent ovarian cystectomy in June 23 and HP confirmed that she was having endometriotic cyst. And she was given modern treatment for 2 months, but patient developed many symptoms because of dynogist. That's why she stopped taking medication after 2 months. So her CA125 was also raised. It was 42.5. So this patient is now also in our follow-up. Actually, we gave her treatment for 6 months, then we discontinued the treatment because the patient was having no pain and the patient was not having any menstrual disturbance. So we have stopped giving any treatment to the patient for 6 months. Then we said, if you develop pain, again you come. So after 6 months, there was relapse of endometriotic cyst. Again, we started her leash therapy. Again, she's responding very well to the leash therapy. So here her scan report shows that she was having 4.2 for 3.6 to 4.2 lesion and the volume was 34 cc. So this was a scan report showing that she was having endometriotic cyst. And this name, why I'm highlighting, the patient gave us the consent that her name can be used. That's why we have not blinded it. And we have taken consent that your reports will be discussed in conferences and publications. Since she readily gave her consent that it can be used. So here again the patient was admitted for surgery. She went laparoscopic surgery for cholelithiasis as well as for endometriotic cyst. So this is a laparoscopic findings in 23. So these are the reports showing that there was increasing endometriotic cyst, and we can see that here the cyst was around more than 5.5 centimeters with 66 cc of volume of the endometriotic cyst. This is in November 2023. So these are the reports of the patient in November 2023. The cyst was around more than 5 to 6 centimeters. You can see the same case, January 2024. Again, she went for scanning because she was having severe pelvic pain. She was not able to bear the pain. Because of pain, she was not able to do her routine work and she was not able to take care of her children also. So she was planning that maybe I have to be always be bedridden. And she was like hopeless of the treatment because she doesn't wanted to go for surgery again because already she has gone surgery in 2023. And you can see the volume of the cyst has been increased here. It is 78 cc. In previous scan, it was 60 cc. It is 78 cc here. So here we can see the findings that in November 2023, the volume was 66 cc and in January it was 78 cc. So she came to us in March 2024, that is last year, 1.5 years back, with severe depression, with severe pain and hopeless with the treatment and planning that I may go for suicide if I won't get the treatment. So we explained about the leech therapy. We said that we can go for this treatment if you don't want to go for surgery now only. Let us see if you feel better. You can go for the surgery after 6 months or after 1 year if the pain is relieved. So we started doing a leech therapy. Along with the leech therapy, we gave her a holistic treatment, Munzija, Balgam and Soda. Then we gave local application as well as oral treatment to the patient along with leech therapy. So she was giving around more than 9 sittings, and sittings we gave weekly once here. Because she was having huge endometriotic cyst, that's why we gave her leeching every weekly. 3 leeches we applied on suprapubic region, and she used to come every weekly for the treatment. So we can see that in third sitting only, the VAS decreased. It was only 2/10. She had only mild pelvic pain. Not only mild pelvic pain, because we started with antipsychotic drug also. Majun and Naja is antipsychotic drug in Unani medicine. We started with that also. And then we started Aslesus also. So here, after giving this medication, we can see that slowly the VAS score was decreasing. It became only mild. So here we gave the treatment according to a Unani protocol, and then we started Munzija Soda, the why, and we were able to see that the patient responded very well, and slowly the leech therapy, which was given weekly, was shifted to fortnightly. So she was giving around 9 sittings, and we can see that in this patient, the cyst was there, but the size has decreased and the volume was decreased. So there was decrease in the volume of the uh, endometriotic cyst. This is the, and she is a well-educated patient. She's engineer. That's why we were able to explain her the procedure and we were able to give her the treatment. Then third patient, she was 28 years old, para 1 L1 with history of severe dysmenorrhea and heavy menstrual bleeding since 5 months, and she was also having, she was anxious to conceive. She had para 1 L1 and A2, and most important thing was she mainly came for infertility treatment with endometriotic cyst. Her CA-125-51, and the doctor said that she may have to go for IVF because there were multiple additions in her, and it was difficult for her to conceive with endometriotic cyst because CA-125 was raised in her. So she came to us because she was very poor. She was not able to afford IVF. She came to us. We started the treatment, but she took time to get conceived. Around 7 to 8 months she took. So we started with her leash therapy. And along with leash therapy, we gave her the oral medications. And after stopping the treatment, after 3 to 4 months, she conceived spontaneously without any treatment. So we can see that this patient was having ovarian hemorrhagic cyst again. She was diagnosed as endometriotic cyst, again 4.1 into 3.2, and with frozen pelvis. So the chances of conception in frozen pelvis is decreased. But this patient uh, conceived after leash therapy, and now she's having a baby of 6 months. She delivered in month of January. She's having a baby now, girl child, delivered by cesarean section. She used to come from Kadapa. From Bangalore, it was around approximately more than 12 hours. She used to come in through train. Night she used to sit, morning she used to come. She used to come from Kadapa. So we gave her only 3 to 4 cycles of leash therapy every 15 days because she was not able to travel. So what she did, we said, if suppose there any nearby, if there is any leash therapy, you can go in nearby hospital. So she went to Ayurveda hospital nearby to take leash therapy because to come from Kadapa, she used to take around, it was around more than 700 kilometers. She was not able to travel. So we said, no need to worry. If any leash therapy is available near your house, you can go for that. So she took only one sitting nearby, but she said that I'm not feeling like I'm not satisfied with the leash therapy given there. I said, no need to worry. We have already taken 4 to 5 sittings of leash therapy. Let us go for the oral treatment. Then after stopping the treatment, she conceived spontaneously. So again, this is the patient, the same patient, December 2022. You can see there was frozen pelvis given in the scan with ovarian adhesions due to endometriosis, left ovary endometrioma. So this is the same case. She's conceived and now she's having a baby. So she was given explanation why she cannot conceive, why she has to go for IVF. They have planned for IVF, but because she was having financial issue. That's why she came to us. So this is her scan. We can see that this in this scan you can see 2023 there was cyst, but the cyst size decreased in this patient. So we can see this is the patient, same patient. Here we can see the size is there, but she conceived and we have said her to send a scan report. She have sent a scan report, and we can see that she was 12 weeks when first report when we saw her. Then after that she delivered. So here, this is the treatment what was given to the patient along with the Unani treatment we have given leash therapy to the patient. Then this is fourth case. She was 32 years of old, and this case is interesting case because all the family members, that is all the 3 sisters were having endometriosis, and one sister was having children, and the other 2 sisters were not having any children because of endometriotic cyst. Again, she was anxious to conceive with severe dysmenorrhea since 1 year, but because she was already more than 35 years, uh, then we gave her the treatment, but the pain was severe dysmenorrhea subsided, but she didn't conceive. Uh, she comes for follow-up now also. And already she has, in 2008, she has gone for ovarian drilling and she had family history of endometriosis. So you can see this patient was having chronic endometriosis, and we can see she went for lap cystectomy in 13 March 2015 also. So around more than 10 years back, she had surgery for endometriosis, but she didn't respond to it. There was recurrence of endometriosis in this patient. So this is her history when she went for surgery 2 times, 2008 and 2015. Then we can see that when she came in July 2024, she was again having endometriotic cyst, both ovaries. So we started giving her treatment, and we did a scan in our own institute also. She was really having endometriotic cyst on both ovaries. She was given treatment. She was given more than 9 sittings in this case also, along with Unani treatment, oral treatment. And again, the leeches were applied on suprapubic region only for this case also. First, initially, we gave weekly leash therapy. Then after 4 to 5 cycles, we started giving leash therapy after 15 days. Most important thing, this patient, the pain subsided. So like this, we used to apply leech therapy on suprapubic area. And again, number of leeches, usually we depending upon the patient, we used, in some patients we have used 3 leeches, in some patient we have used 5 leeches. And this patient, why I wanted to show you that, this patient, the blood, first time when we did leech therapy for this patient, the blood was having very foul smell and the blood was very thick in her, and we say that this is because of Sadavi. We were able to see that the blood was very thick and black, and it was very foul smelling. But when we went for leech therapy on third cycle, third sitting, the smell was decreased in this patient. And the patient only gave the evidence that, madam, the blood was very foul smelling when they applied leech. And first time the leech, whenever we used to apply this patient leech, the leech used to die in this case. 2 times, first 2 sittings, the leeches died, so we have to use new leeches for this patient. Then again, this is 5th case. Again, this case was also 34 years old, para 2 L2, came with endometriotic cyst and with normal cycle. She was only having pain. So for this case also, we applied leech therapy. Again, she was also having both. You can see she was having left ovarian endometriotic cyst. So here mainly with scanning, we can only diagnose ovarian endometriosis. So therefore, whatever the cases we presented here, they were usually having ovarian endometriosis. Again, we can see the CA125 was increased in this patient. This patient was sister of the previous patient. She was having 3 children, but they both were sisters. So we went for CA125 to confirm that she is also having endometriotic cyst. So this patient and previous patient both were sisters. So what we can see, the type of endometriosis, we can see most common type is, we usually see in ovaries, pouch of doglets, ligament of uterus, fallopian tube and rectovaginal septum. Whereas other sites or rare sites are umbilicus, vulva, perineum, intestine, operative scar, kidney, liver, diaphragm and lymph nodes. Recently we saw that the patient was having pulmonary endometriosis also. So here we can see the commonest cause of endometriosis is ovarian endometriosis. It is seen in 55% cases. Therefore, whatever cases we have seen, usually they came with endometriotic cyst, ovarian endometriotic cyst. Other, it is very difficult to diagnose. Only with the help of pelvic adhesions or change in the position of the uterus, we can say that the patient is having adhesion. Otherwise, mainly endometriotic cyst can be diagnosed with the help of scanning. The majority of diagnosed cases can be broadly characterized into 3 pelvic cavity subtypes: superficial, peritoneal. 80% of endometriosis is ovarian and deep. Non-surgical diagnostic approaches, including transvaginal ultrasonography and MRI, can be useful in the detection of ovarian and deep endometriosis. So here we are seeing that there are main 3 types: superficial, peritoneal. 80% will be of ovarian type. So we can see how ovarian endometriosis is formed. Slowly there is invasion of surface lesion, then hemorrhage and formation of endometrioma. And then slowly the blood will get collected in the endometrioma, causing it to enlarge. So then we can see that, as I said you, case 4 and case 5, own sisters, both had endometriotic cysts. What it is said, endometriosis is reported to run in families. Almost first degree relatives, the prevalence is increased by 6 to 9 fold. So these both sisters, all the 3 sisters were having endometriosis. One sister had children, other the sisters didn't have any children because of endometriosis. What is the main cause of endometriosis? In families, it is identified that 2 modified regions of chromosome 7 and 1 are, one are first reliable evidence for DNA changes. So we see that 7 chromosome and 1 are affected in endometriosis. Most important epigenetic factors like DNA methylation and histomodification can explain the progesterone resistance of the implant and the overexpression of estrogen receptor beta. What we say that endometriosis is usually estrogen dependent disease. So here we can see that estrogen progesterone hormone imbalance occurs. Therefore, the patient will develop endometriosis. What is the pain in endometriosis? Mainly my target is to treat pain here. So more than 60% of women diagnosed with endometriosis report chronic pelvic pain, with endometriosis patient 13 times more likely to experience abdominal pain than healthy subject. That means chronic pelvic pain is a commonest symptom in endometriosis. Then, despite this disease homogeneity, the mechanism by which endometriosis induces a chronic pain state remain poorly understood. So, why the woman will develop pain or why the patient is having chronic pain, it is very difficult to understand. But however, some studies have reported why, what is the mechanism of pain in endometriosis. Depression, again, in common with other chronic pain conditions, women with endometriosis report suffering from fatigue and depression. So we be able to see that case 2, 3, and 4 were having history of fatigue and depression. Then infertility is significantly higher in patients with endometriosis compared to the general female population. Again, case 3 and 4 came with history of infertility to us. 15 to 87% depressive symptoms are seen in endometriosis, and in 29 to 88% patients may come with anxiety disorders. So we can see case 2, 3, and 4 were having depression. Endometriosis patients with severe pain are significantly more likely to show depressive symptoms and anxiety disorders. Recurrence after surgery, we were able to see that case 2 and case 4, though they underwent surgery for endometriotic cyst, again they developed endometriosis. It is becoming more and more apparent that the results of conventional therapies are not satisfactory in long run. While surgical therapy was considered the main intervention for many years, it must now be recognized and accepted that repeated surgery does not guarantee long-term improvement concerning the patient's desire to have children, nor regarding pain reduction. So here let us see the role of leech therapy in endometriosis treatment. How leech therapy works. As we all know that dysmenorrhea is called as usrit thumbs in Unani medicine, and the causes of dysmenorrhea can be external, dietary, distemperament, morbid humors or gases, inflammation, obstruction, menstrual and anatomical. So we see that dysmenorrhea, the traditional Unani medicine say that there are many causes which can cause dysmenorrhea. So we can see inflammation as one of the cause for endometriosis, as well as metritis, cervicitis, and ovarian diseases. So here our Unani concept correlate very well with the modern concept that inflammation can also lead to dysmenorrhea. So here in Unani we see that the many classical texts and our Unani physicians have described about pain or dysmenorrhea, and the cause of dysmenorrhea also they have said, and also that with dysmenorrhea they said that the patient may have other symptoms like anxiety, nausea, vomiting, and dizziness, and mainly distemperament is one of the cause for dysmenorrhea. So here we correlated the disease with the symptoms, because usually endometriosis is a new entity which was not discovered previously. So, but when we see the literature, already the description of the disease is available according to the symptoms. So we can see that our Unani physician said that nerves play an important role in type of pain. So here I will show you how the neuroinflammation and this neuro pain is important in endometriosis. So this concept is also clearly mentioned in our Unani books that the involvement of nervous system plays important role in chronic pelvic pain. Again, we can see Varme Rahem Sulp Saudavi, that means distemperament of black bile can also cause dysmenorrhea, or it can cause inflammation in the uterus. So Vermeer is inflammation in the uterus, which is caused because Saudavi means black bile. So we are seeing that inflammation is caused in the uterus because of black bile. It is one of the cause to lead to infection causing pain to the patient. Leech therapy has been used to treat numerous medical conditions throughout history. There is abundant evidence of its application in ancient Greece, Rome, Arabia, and India as a method of local blood depletion or bloodletting. Leaching is a bloodletting process using medicinal leeches to treat various diseases. Leaching is a bloodletting method for areas where other techniques like vivisection and cupping cannot be used. So here we can see that it is not a new theory or new treatment. Leech therapy is as old as medicine. We can see Galen in 130 to 201 AD. He has described about the body fluids and how to use leech therapy. Likewise, he said that illness elevation can be achieved by restoring the balance between the body fluids when a leech withdraws blood from the patient. He prescribed bloodletting by leech for simple inflammatory condition, mental disorders, and hemorrhoids. Again, Avicenna, as we all know, he is a well-known physician in Unani medicine, and not only in Unani medicine, but till 16th century in Europe, his books were used to teach medicine. So Avicenna in 1980 to 1037 AD, he said leech can suck blood from the deep veins which cannot be reached by the conventional wet cupping, and he recommended leeching for skin diseases. Same like that, sorry. Ibn Masih also said that leeching therapy is very good in poisonous. Leech therapy is very useful in diseases, and he differentiated between the medical leeches and non-medical leeches, and how to know which type of leech can be used for treatment. Then again, there are many treatments which can be given in endometriosis, like deobstruction therapy. We can give medicines which increase the faculties of the uterus, and it improves the temperament of the patients. So Ibn Sina stated that both distemperament and disorder in a structure can cause pain. If the pain is caused by distemperament, distemperament because of madda or morbid matter, evacuation of the morbid matter is necessary. For that purpose, we can use leeching is effective for evacuating morbid matter in patients who are elderly, disabled, children, or women. So here, leech therapy can be used in vulnerable patients like elderly, disabled, and children also. Leeching proves beneficial in situations where venesection and cupping are not feasible. So where we cannot use cupping or where we cannot use venesection, there we can use leech therapy. Leeches extract blood from the deeper tissues, because cupping or venesection, it is in between venesection and cupping. Before performing leeching, venesection and purgation should be carried out to facilitate evacuation, making the procedure more effective. So what we can do before going for leeching, we can go for simple purgation or venesection, then go for leech therapy. Leeching procedure removes more dumping mother than cupping, but less compared to venesection. That means it comes in between cupping and venesection. When leech is detached from the body, wet cupping should be applied to draw out the remaining blood, ensuring better purification of the area. So what we did in these cases, after applying the leech, once we remove the leech, we have applied cups so that whatever the remaining blood was there, it can be removed easily. But what we did in this case is, before going for leech therapy also, small cuts were made and cupping was given before giving leech therapy also, so that more of the blood is drawn to the skin and leech can be applied easily. So we have applied cupping before and after the procedure also. So leech therapy is useful in gynecological disorders as well as in male and female infertility, endometriosis, parametritis, mastitis, and fibromastopathy. Leech secretes, as we all know, as you people also very well known, that leech therapy secretes more than 100 identified bioactive substances which are having anticoagulant, anti-edematous, anti-inflammatory, analgesic, platelet inhibitory, thrombin regulatory function, extracellular matrix degradative action, and antimicrobial. So we can see that in endometriosis, the extracellular matrix is more, which is causing inflammation in the patient. So it causes degradation of the extracellular matrix also. Following a leech bite, it has established a sucking pathway. So we see that it causes extracellular matrix degradation, and it inhibits adhesions, aggregations, and coagulation. So it inhibits the function of platelet and acts an anticoagulant effect. What happens once we apply the leech? It increases the blood flow, protect itself by having antimicrobial activity, and avoid reduction by producing analgesic and anti-inflammatory effects. The saliva possesses resolving activity, eliminates microcirculation disorders, restores the damaged vascular permeability of tissues and organs, and eliminates hypoxia. This point is very important because the same mechanism is seen in endometriosis. So this helps to resolve the biomolecular problems in the patient. Reduces blood pressure, increases immune system activity, detoxify the organism by antioxidant pathway. Again, we can see that it activates the immune system. In endometriosis, the immune system gets activated. It suppresses the immune system, thereby decreasing the endometriosis. Relieves it from the threatening complications such as infarct, strokes, and improves the energetic status of the organism. So we can see the composition. All we know that there are many factors in lead saliva which are useful in different type of problems. Like we see it is having anti-inflammatory, analgesic, anticoagulant, vasodilator effect. We can see it is having vasodilator effect also. Histamine-like structures are also produced which has vasodilator effect. So mechanism of pain in endometriosis, and discuss the mechanism of action of leech therapy in endometriosis. So as I said you, despite more than 100 years of extensive research, the cause of endometriosis is unknown and the pathophysiology understood is only partially. So we don't know the exact cause of pain in endometriosis and why the endometriosis is occurring. It is still unclear why endometriosis may cause symptoms in some women and no symptoms in some women, and diagnosed, although they have been diagnosed with the disease. Endometriosis is just an epiphenomenon that causes abdominal pain, and the pain, again, the intensity of pain differs from patient to patient. So then we know the theories of endometriosis. It can be coelomic metaplatic theory or Sampson's theory, which is the most important theory, which is believed causing retrograde menstruation is the commonest theory which is followed in endometriosis. Along with that, there are stem cell theory, vascular lymphatic metastasis theory, genetic theory, and embryonic race theory, de-innovation and re-innovation theory. So all these theories which proves that the endometriosis causes inflammation in the pelvic cavity, but none of the theory has been proved. So we can see that there is implantation of endometrial cells in any of the theories. There is implantation of endometrial cells, adhesion of peritoneal surface, angiogenesis, growth of endometrial cells, proliferation, inflammatory reaction, which leads to endometriosis. We can see that mainly there is formation of new vessels. Leech therapy decreases the formation of new vessels. That's why it is more effective in cases of endometriosis. And again, it is having anti-inflammatory activity, and moreover, it decreases proliferation in the cells, thereby helping the patient to recover from pain. So we can see that biologically active substance produced in ectopic endometrium is cytokines, that is inflammatory markers, MMP, VEGF1, growth factors, estrogen, prostaglandins. These are the bioactive substances which are produced in endometriosis, which causes adhesion to peritoneal surface, invasion, angiogenesis, growth, proliferative changes, and inflammation. So these are the molecules, or these are the substances which produces the activity or inflammation in the endometriosis, uh, endometriotic, wherever there is endometriotic lesions. So current concept of endometriosis development, they say that the main cause of endometriosis results either from retrograde menstruation or the vascular or lymphatic spread of endometrial cells or endometrial stem cells. Just now I showed you the theories. So we can see that retrograde theory, that is Sampson's theory, or lymphatic theory, or endometrial cells theory, all this causes retrograde menstruation or release of endometrial cells in vascular or lymphatic spread or stem cells. So how it is causing endometriosis means under the influence of immune cells, apoptosis occurs in the area of ectopic colonies in the peritoneum. So why, as we all know, that endometriosis is extrauterine. Endometrial tissue is present extrauterine. Extrauterine means it can be present in pelvis, it can be present in ovaries, it can be present in far away places like lungs also, or liver also. So what we see that the endometrial tissue travels through vascular system or lymphatic system or through retrograde menstruation, and again it is through the influence of immune cells which causes apoptosis of the endometrial cells, leading to responsive immune, and it affects the peritoneum. Activation of the peritoneal macrophages with increased cytokine production in women is seen in the endometriosis. That's why we are seeing that immune response are more in the cases of endometriosis. Here we are able to see that immune markers and inflammatory markers like cytokines are produced, macrophages are produced in the peritoneum, causing inflammatory reaction in the pelvis. So we can see what is happening, current concept of endometriosis, what is happening here. We can see there is invasion causing angiogenesis, there is implant leading to chronic inflammation, oxidative stress, and proliferation. Let it be retrograde theory, let it be vascular theory, or lymphatic theory, or stem cells theory. All the theories are having same effect on the same effect in the peritoneum, causing responsive immune system, leading to oxidative stress. We can see if this process is disrupted, It can cause apoptosis, invasion of the foci with activation of angiogenesis and formation of endometrial implants in the target tissue. So mainly we can see that new vessels are also formed. That's why this endometriotic implants can grow at the time of menstruation, thereby causing patient having inflammation leading to release of prostaglandins, and this prostaglandins is the cause of pain. So here again, as I said, endometriosis is not only immune response, but it is also an inflammatory disorder where we can see that there is actually a link between immune cells, nerves, and central pain pathway. So we can see this pain is not only limited to the uterus, but slowly this pain can cause involvement of nerves leading to central pain pathway, stimulating the pain pathway, though the patient may not have uh, endometrial cells released or implants, but because they are getting the ends of that endometriotic lesions will get sensitized to the nerves may get sensitized to the pain, thereby stimulating the central pain pathway. Pro-inflammatory factors are increased in patients with endometriosis like interleukins 1, 6, 8, and 33, tumor necrotizing factor, and insulin-like factors. All these pro-inflammatory factors are increased in the cases of endometriosis. There were also several population of adaptive immune cells, that is T and B cells, as well as rare populations such as mast cells. Mast cells means there is chronic inflammation in the endometriotic lesions. These include increased number of innate immune cells as well as evidence of increased T cell activation and effector activity. So this is a new or current concept which shows that the pain which is seen in patients with endometriosis is not only because of inflammation, but because of immune responses as well as stimulation of nerve endings in this endometriotic implants. So we can see local estrogen is produced by the aromatase activation. Estrogen stimulates prostaglandin synthesis via the activation of COX-2 enzyme. This prostaglandin again stimulates aromatase, whether the aromatase is activated in the endometrial lesion itself or in the surrounding tissue is contribution. So we are seeing that the pain which is initiated in endometriotic implant is not only because of one factor, but there are multiple factors which causes inflammatory reaction, and this inflammatory reaction leading to release of inflammatory markers causing pain. Prostaglandins are key inflammatory mediators implicated in the regulation of process relevant to endometriosis pathophysiology, including angiogenesis, estrogen biosynthesis, and pain symptoms. We are seeing that the pain which is caused in endometriosis is multifactorial. Again, we can see that this is the endometriotic lesion where angiogenesis is seen, where there is formation of new vessels. That's why every month the patient may have pain. Then we can see not only angiogenesis, but we can also see that there is neuroangiogenesis in these cases. Here, what will happen? The nerve endings will also get stimulated here, and the vessels are also they supply to nerve ends or nerve cells, which is leading to pain or nerve pain. Lesions are complex multicellular structure with stroma and epithelial compartments with former containing fibroblasts, multiple subtypes of immune cells, angiogenesis, nerves and region of fibrosis and hypoxia. We can see blood vessels and nerves that invade the lesion are found in close proximity. So we can see that the nerve ends are also getting involved in the endometriotic implant. This is endometriotic implant. We can see this is endometriotic implant, and this endometriotic implant is having good blood supply. Not only good blood supply, it is also having good nerve supply. That's why the patient will have sensation of pain, though there is no inflammation or there is less inflammation also, but as the nerves are getting sensitized here, the patient may feel pain. Mesothelial lining, the cavity, and some macrophages population produce lactate as a byproduct of metabolism. So we can see that metabolic responses are seen in these cases, leading to development of pain. So here the new study says that immune cells play in promoting angiogenesis and lesion innervation, and suggests that targeting macrophage monocytes recruitment might offer promise as a way of reducing lesion growth or pain. So what they are doing now? They were able to say that the macrophages are increased in the endometriotic plan. So they started giving anti-inflammatories and anti-macrophages drugs which can decrease endometriosis. And again, as we know that main cause of pain is estrogen. That's why we can give progesterones in these cases, which can decrease the imbalance between estrogen and progesterone. So estrogen may modulate the release of bioactive granules that can stimulate nerve activity, and mast cell stabilizer have been explored as a potential therapy for endometriosis associated pain in preclinical models. Then, as I said, you angiogenesis, neuroangiogenesis and neuroinflammation is a common cause of pain in endometriosis. So, this is the study which shows that how the neuroangiogenesis occurs here. The description of link between the growth of new blood vessels and the nerve fibers have provided a mechanism that could explain the association between the presence of ectopic tissue and pain pathway. So, here, how the patients are developing pain, though it is outside the uterus, why the patients are developing pain? Because of involvement of nerves. Neuroangiogenesis is regulated by estrogen and immune cells, including macrophages, which are important source of vascular endothelial growth factors and nerve growth factors. Because of involvement of macrophages, there is increase in vascular endothelial growth factor as well as nerve growth factor. That's why these lesions are now becoming neuroangiogenesis. Increased attention has also been paid to crosstalk between nerves and immune cells, with neuroinflammation believed to play a role in activation of both central and peripheral pain pathway in endometriosis. So we can see that the patient is not having localized pain in ovaries. The patient may have vague pain in the whole abdomen because of involvement of nerve pathways. The different visceral organs share common nerve pathways to dorsal root, ganglia, and spinal cord, allowing the potential for cross-organ sensitization. That's why the patient will develop bloating. The patient will develop pain which is not in the pelvis. It can be in upper abdomen also, or it can be vague pain involving both the lumbar quadrant because of cross-organ sensitization. The enhanced stimulation and activation of peripheral nerve ending in the peritoneal cavity, that is peripheral sensitization, increases the painful stimuli transmitted to the spinal cord, initiating and maintaining chronic pelvic pain, causing central sensitization. That is, the patient is not having only pain during premenstrual, but the patient may have pain in whole menstrual cycle because of involvement of central nervous system causing chronic pelvic pain. So not only peripheral sensitization is occurring, there is central sensitization also, thereby leading the patient to have decrease in quality of life. We can see that central sensitization is occurring. There's enhanced pelvic nociception causing enhanced immune response. And again, as I said, it can be retrograde menstruation, it can be stem cell theory, it can be vascular theory, any theory. It is causing inflammatory increasing in inflammatory markers like macrophages, neutrophils, and mast cells, and release of chemokines, which can cause stimulation of nerve endings, leading which may affect the peripheral nerve ending and causing neurogenic inflammation or peritoneal inflammation. So here we can see there is not only peritoneal inflammation, there is neurogenic inflammation, which leads to peripheral as well as central sensitization of pain. And again, cross organ sensitization, sometimes the patient may have lesion anywhere near the sacral, but the patient may feel pain in bladder, the patient may feel bowel symptoms, the patient may feel other symptoms because of cross organ sensitization. The phenomenon of cross-organ sensitization describes the spreading of nauseous inputs from a diseased visceral organ to a normal organ in close proximity. Has been studied in other pathological conditions where comorbidities are common, including IBS, IBD, interstitial cystitis, and other CPP disorders, as chronic pelvic pain disorders. So, experimental evidence of functional cross-organ sensitization in the pelvis has been observed in many combinations, including bladder, colon, vagina, colon, bladder, uterus, and colon. So the patient usually come with history of having pain, rectal pain, because of cross-organ sensitization. The patient may complain of low back pain associated with constipation, dysentery, and pain in rectum. So, according to Unani concept also, inflammation of the anterior part of the uterus is manifested at lower abdominal pain with associated urinary symptoms like dripping or retention of urea or dysuria. So, this, though the endometriosis was not known by this name, but the symptoms were already described in the book, and the treatment according to the symptoms has been described in the book. So, we can see how the leech therapy works. Leech saliva has anti-angiogenesis. As we said that in endometriosis, there is angiogenesis. So the leech saliva produces anti-angiogenesis, which prevents the growth of new vessels. So anti-angiogenesis is a new therapy principle since angiogenesis plays a role in the implantation and progression of endometriosis. So what they are doing now, they are developing medicines which have anti-angiogenesis effect. So they have done a study on nanomaterials which have anti-angiogenesis effect, which are helpful in cancer therapy. Same like that, it is also helpful in the endometriosis. Substance directed against VGEFA tested, the development of endometriosis implant was suppressed by these substances. So they gave nanoparticles having anti-angiogenic activity, and they were able to say that the VGF was decreased in the cases where anti-angiogenesis was given. So we can say that the leech protein in liposomes has a nanocarrier inhibits angiogenesis via targeting VGEFA. So what they did, they took the saliva of the leech and they produced molecules from there, and they made nanocarriers which can carry this protein and can see the effect that it is having anti-angiogenic effect in the cancer cells as well as in endometriosis. Present data demonstrate the impressive impact of medical leech therapy, leech saliva protein inhibition on tumor growth and angiogenesis, and improves the tumor hypoxia. The same theory can be applied in the endometriosis, because in endometriosis also angiogenesis is occurring, as we see the angiogenesis in cancers. Hirudin inhibits both platelet aggregation and coagulation cascade, marked relief of venous congestion. So we are able to see that usually in chronic pelvic pain, the patient will have complaint of venous congestion. The patient will have vague discomfort over the whole abdomen. So when we give leech therapy, the pain not only in the lower pelvis, but the vague pain which she was having in the whole abdomen also decreases, because it inhibits the platelet aggregation and coagulation cascade. So we saw how the leech therapy helps it as an anti-angiogenesis effect. Now let us see how it has anti-inflammatory effect. Hypothesis proposed that the inflammation could be reduced by the anti-inflammatory action of dilins and algins in leech saliva. So the leech saliva is having dilins and algins which are having anti-inflammatory activities. It reduces the inflammation. It also contains hirudin, kaolin and other substances that increases microcirculation by decreasing the blood viscosity. As I said you, one patient when we applied leech, first day she had a very thick blood, foul smell blood. The leech died. So we saw that it decreases the blood viscosity. So because as per our Unani concept, this endometriosis is caused because of black bile, and the black bile is the thickest in the blood, which disorders pain, the mechanism by which endometriosis causes a chronic pain state. More complex pathophysiology in endometriosis induced pain cannot be explained by endometrial lesion alone. So we cannot say that only the lesions are causing, because it is because of neuroengineering. Chronic remodeling of the nervous system occurs in complex incident. We are seeing that increase the clinical patient having low backache, depression, and other things because of pain. So we can see sensory C fibers, AD fibers, cholinergic and adrenergic nerve fibers have all been detected in this lesion. So we were able to see that it is involving the nervous system also. That's why the new concept of endometriosis says that it is having neuroangiogenesis and neuroinflammation, leading to patient having chronic pain. So we can see that the patient develops chronic pain. Not only pain, we can see myofascial trigger points are also been stimulated here. Simple pain can also cause a decrease in quality of life. In women with endometriosis, the chronic inflammatory milieu has been linked to the generation of pain. So here, the main cause of pain is chronic inflammation. So again, the leech saliva has analgesic effect. So we know that there are multiple studies suggesting mean by which leech saliva may have effect or analgesic effect. So hirudin again is having thrombin inhibiting effect, vasodilator effect, and other effects. So here the experimental studies showed that. Then 12 experimental studies show the main therapeutic mechanism of toxic animal-based medicinal material against endometriosis by pro-apoptotic anti-angiogenesis, estrogen level reducing, and possibly anti-inflammatory effect. So by this we can say that already sir has put this figure in this uh, Rucher. So I want to say this already. You can study from that. Effectiveness of Unani treatment in decreasing pain and managing endometriosis symptoms. So as I said here, we can go for diet. Giving anti-inflammatory diet is also useful in endometriosis. Then one important thing what I want to say is endobelly. In endometriosis, the patient will have endobelly. This endobelly is what the patient may have bloating symptoms. So leech therapy is useful in this endobelly also. Then, as I said, we can give anti-inflammatory foods compared to inflammatory foods. So we can see all the processed food, alcohol, refined carbs are inflammatory diet, which can increase the. It is a risk factor or predisposing factor for the endometriosis. So if we take anti-inflammatory diet like uh, onion, garlic, leafy vegetables, these are also helpful in the decreasing the inflammation. So again, omega-3 diet. Again, we can see there are many medicinal plants which are acting like diet, like almond, vitamin C, vitamin E, and vitamin E are present in many. Like vitamin C, we can say amla is there, triphala is there. We can give these as medicine as well as diet, which can help to decrease the inflammation. So here there are some drugs which can be given as an anti-inflammatory in endometriosis. Joshande Munzich, what we used to give, it has fennel seeds, carob seeds, aslesus, kasni, and iskhan. So these are all Unani medications which can be given in are given before giving bleach therapy. So again, we gave Maramidactylium. It is a compound drug which is having all these drugs which are having all inflammatory actions and analgesic effect. So here we have not only given leech therapy, we gave holistic approach following both regimenal therapy as well as oral therapy. Medicinal leech therapy remains a valuable traditional technique with a strong biochemical effects. Though the exact mechanism requires further investigation, its utility in treating conditions like endometriosis, where it may help reduce pain and inflammation, is promising. However, careful evaluation of indications, complications, and treatment protocols is essential. Comprehensive studies are needed to fully assess medicinal leech therapy efficacy, safety, and potential benefits in these complex diseases. In conclusion, while leech therapy has re-emerged with proven therapeutic application, ongoing investigation and evidence-based practices are necessary to maximize its potential in modern medicine for endometriosis and other diseases. With this, I thanks all the audience who are virtually present with me.
थैंक यू वेरी मच डॉक्टर। अरे बड़ा गजब फ्लो, सैल्यूट, सैल्यूट डॉक्टर, सैल्यूट आपको। इतना न तो किसी में, इतने फ्लो में सुंदर सम्मोहक ढंग से आपने बोला है कि मैं कैसे तारीफ करूं ये नहीं समझ पा रहा हूं। मुझे ये लगा मेरी छोटी बहन मिल गई एक नई मुझे। और दूसरी बात कहना चाहता हूं आपसे, आप प्रोफेसर हैं,
जी
मैं
सर।
चाहता हूं कि एक यूनानी की सीरीज शुरू की जाए जिसमें
जी
आप बात कर लीजिए अपने साथियों से।
जी
पहले इदरीस साहब, यूनुस साहब सभी जुड़ते हैं अपने यहाँ, लेकिन हम वीकली एक यूनानी के ऊपर जो टॉपिक आप लोग दोगे वो हम शुरू करना चाहते हैं, नंबर एक। और
जी सर।
नंबर दूसरी, मैंने अभी चैट बॉक्स में अपना प्रोग्राम डाला है सितंबर का,
जी सर।
तो उसमें आप किस किस टॉपिक पे बोलना चाहते हो ये भी बता दीजिए।
ओके
ये
सर।
मैं आप लोगों से रिक्वेस्ट करता हूँ।
ठीक है सर, मैं कर।
बहुत अच्छा। ये कंसेप्ट मतलब इतनी वेबिनार्स हो गई हमारी इनफर्टिलिटी और वुमन वेलनेस पे, लेकिन ये थेरेपी पे नहीं हुई।
सर
बहुत अच्छा बताया।
जी सर, हमने एक्चुअली ये 2 साल से हम लगातार कर रहे हैं लीच थेरेपी पे। लेकिन सबसे बड़ा ड्रॉबैक क्या है कि लीच मिल नहीं रहे सर आजकल, क्योंकि ना सीजनल ग्रोथ रहती है इनकी। इसकी वजह से थोड़ा प्रॉब्लम आ रहे हैं। मेनली कैसे
ओ,
हमको क्योंकि लीच बैंक है वो हम एक्स्ट्रा बनाने की कोशिश करें, क्योंकि जो भी लीच लाते हैं वो हम वेंडर से लेते हैं, अक्सर लीच मिलते नहीं। लीच प्रॉब्लम हो रही है, तो उसके लिए थोड़ा सा ट्रीटमेंट हमारा कम हो जा रहा है, ट्रीटमेंट कंप्लायंस कम हो जा रहा है, क्योंकि अवेलेबिलिटी नहीं रहती है लीच के हर सीजन में। जैसे कि समर में नहीं मिलते आपको, तो फिर हमको ट्रीटमेंट रोकना पड़ता है पेशेंट्स का। लेकिन अभी जो पेशेंट है।
बेंगलोर
जी, बैंगलोर में हमारे पास एक दो वेंडर्स ऐसे बहुत कॉस्टली दे रहे हैं, और फिर वो हमारा कॉलेज के नजदीक कोई भी ऐसा है नहीं वेंडर्स जो लिस्ट पे प्रोवाइड कर सके। तो थोड़ा सा दिक्कत हो रही है हमको करने के लिए। लेकिन रिस्पांस
ओ,
बहुत अच्छा
ओ,
है पेशेंट को। रिस्पांस मतलब आप यकीन नहीं करेंगे, जो सेकंड पेशेंट मैंने कहा जो इंजीनियर थी, उसको तो इतना ज्यादा डिप्रेशन था कि वो सुसाइडल अटेम्प्ट तक करने वाली थी। अभी वो आ रही है सर, मैं
ओ,
6 महीने के बाद अब फिर ट्रीटमेंट के लिए आई, क्योंकि फिर से उसका एंडोमेट्रियोटिक्स बढ़ गया है। वो फिर आ रही है, फिर उसका हम ट्रीटमेंट दिए 2 महीने, अब दिए तो फिर उसका साइज छोटा हो गया है। तो मैंने कहा देखो 1 ईयर, अगर फिर भी ऐसा रहा तो फिर हम प्लान करेंगे सर्जरी के लिए। सबसे इम्पोर्टेंट सब पेन, पेन बहुत अच्छा रिलीव हो जा रहा है एंडोमेट्रियोसिस का, क्योंकि पेशेंट मेनली पेन के
अरे,
साथ आते हैं मेरे पास।
बहुत अच्छा, बहुत अच्छा। वो जैसे वही लीच वाली लीच स्मूथली पीती है, और कोई हाइपर टेंशन के लिए यहाँ की नस का वेदन करते हैं।
जी जी।
महाराष्ट्र में है कोई,
हम्म,
यहाँ जो यहाँ से 50 ml, 20 ml वो ब्लड निकाल लेते हैं, तो
जी
उसका मालूम पड़ता है कि हेडेक कम हो गया।
जी जी जी
ये भी एक तरीका है। कोई भी कुछ भी ऐड करना चाहे या मैडम से पूछना चाहे तो
जी।
उसका स्वागत है।
ओके सर।
मैं अपनी ऑडियंस से रिक्वेस्ट करता हूँ कि यदि आप लोगों में से कोई कुछ पूछना चाहे तो उसका स्वागत है। बहुत अच्छा। अभी तक कोई, मतलब आपने इतना सरल ढंग से और अच्छे ढंग से बताया कि मेरे ख्याल से किसी के दिमाग में क्वेश्चन ही नहीं उठे।
तो एक्चुअली 8 बजे के टाइम रहता है ना, अक्सर लोगों का डिनर टाइम रहता है।
कोई बात नहीं, कोई बात नहीं। सो थैंक यू वेरी मच। आपने बहुत अच्छा बताया। मैं नहीं समझता कि किसी का कोई, आदरणीय सीपी शर्मा सर, डॉक्टर सीपी शर्मा सर, यूनिक सब्जेक्ट है।
जी।
आदरणीय सीपी शर्मा जी तक हमारी आवाज जा रही है? डॉक्टर सीपी शर्मा सर एक्स जॉइंट डायरेक्टर हैं गवर्नमेंट ऑफ एमपी के, आयुष के।
जी
और नवीन जी कुछ बोलेंगे क्या? डॉक्टर नवीन गुप्ता जी फ्रॉम यूके
Namaskar,
एंड
sir. Namaskar, sir. I
स्विट्जरलैंड।
just joined, so I didn't listen anything. So I was interested in
आई
getting to know more. I
आई
just,
मीट,
I just entered. I'm sorry that I could not listen.
बात नहीं, कोई बात
So I
नहीं,
cannot comment. I cannot comment.
कोई बात नहीं।
Thank you.
थैंक
Thank you.
यू
Thank you.
आपके
Thank you.
ज्वाइन होने के लिए thank you। कोई भी कुछ पूछना चाहे, अदरवाइज हम इस वेबिनार को कंक्लूड करेंगे।
एक्सक्यूज मी
मेरी,
सर।
हाँ, शराब जी बोलिए प्लीज।
सर, अगर जैसे लीच नहीं अवेलेबल है तो उसके लिए हम लोग क्या कुछ और अल्टरनेटिव कर सकते हैं? मैम से क्वेश्चन है मेरा।
जिस अंदाज में हमने एंडोमेट्रियोसिस में लीच का इफेक्ट देखा है, तो अब जब हम लीच
जी
अवेलेबल नहीं है तो हम वेट कपिंग करना स्टार्ट किए। लेकिन जिस तरीके से यूनानी में ये बताया है कि विनिसेक्शन और वेट कपिंग के बीच में लीच थेरेपी आता है, और
जी
लीच
जी जी
डीप, क्या बोलते हैं, लीजन्स जो होते हैं डीप सीटेड रहते हैं, लेकिन वेट
जी
कपिंग
जी
थोड़ा सुपरफिशियल एक्ट करता है। और हम विनिसेक्शन
एकदम
विनिसेक्शन
डीप।
भी कर सकते
जी
हैं। विनिसेक्शन
जी
तो
जी
मैंने ट्राई नहीं किया, एमेनोरिया में किया है, लेकिन
जी।
एंडोमेट्रियोसिस में नहीं किया। तो हम वेट कपिंग कर दे रहे सुप्राप्यूबिक एरिया में, तो पेन तो कम हो रहा है, लेकिन लीच थेरेपी में क्या है,
उतना अच्छा इफेक्ट नहीं आ रहा जितना लीच में आ रहा
लीच में क्योंकि उसके जो सलाइवा में जो एक्टिविटीज बताएंगे,
है। जी
जो
जी जी
मैकेनिज्म ऑफ पेन बताया गया है, जो नया करंट कॉन्सेप्ट है, वो कॉन्सेप्ट एग्जैक्टली हमारे लीच थेरेपी में जो एक्टिविटीज पाए गए, लीच सलाइवा में जो एक्टिविटीज पाए गए, एग्जैक्टली वही है। मतलब एंटी
जी।
इन्फ्लेमेटरी है, एंटी एंजियोजेनिक है, और एनाल्जेसिक है, ये तमाम चीजें इसके अंदर है। तो कॉन्सेप्ट जो मैकेनिज्म बताया गया है मॉडर्न में, वो मैकेनिज्म से अगर हम कंपेयर करें तो लीच थेरेपी ज्यादा इफेक्टिव है। लेकिन क्योंकि अभी हम
जी।
रिसेंटली क्या हुआ, अभी लीच बहुत मुश्किल हो गया हम लोग को मिल रही। अब
तो
पेशेंट,
मैम इसकी अवेलेबिलिटी कैसे बढ़ा सकते हैं? हम लोग कुछ कर सकते हैं ऐसे
हाँ
इजीली अवेलेबल हो जाए हर जगह
हम
ये?
क्योंकि कॉस्मेटिक में भी अब ज्यादा यूज हो रहे हैं लीच, तो फिर बहुत मुश्किल हो गई। तो हम लीच बैंकिंग कर सकते हैं, जैसा हम एनिमल्स को, जैसा मतलब एनिमल हाउस है, जैसा एनिमल्स के लिए हम रिसर्च के लिए एनिमल्स को टेक केयर करते हैं, उसी तरीके से हम लीच बैंक बना सकते हैं। लेकिन हैदराबाद में है हमारे कोलिग जो लीच बैंक चलाते हैं, मतलब वो पूरा तरीके से इसको क्या बोलते हैं, उनकी ग्रोथ, उनका कौन से सीजन में उनको बड़ा करते हैं, वो सब उनके पास है, तो वो करते हैं। तो हैदराबाद में जो भी लीज सप्लाई होती है वो हमारे कोलिग के
सर
थ्रू।
गवर्नमेंट से हम लोग को कुछ ऐसे हेल्प नहीं मिल सकती इस तरीके का बैंक बनाने में, कुछ फाइनेंशियल एड या इस तरह की कोई चीजें जिससे कि
हमको
सिस्टम को प्रमोशन हो?
प्रोजेक्ट बना के देना पड़ेगा, मिल सकती है अगर आप कोई प्रोजेक्ट बना के देते हैं कि हम वी वांट टू ओपन द लीच बैंक। तो जिस तरीके से एनिमल हाउस का मेंटेनेंस रहता है, इस तरीके से हम लीच थेरेपी का भी लीच का भी मेंटेन कर सकते हैं, क्योंकि इनका प्रोपोगेशन वो सब रहता है।
तो मैम उसके लिए हम लोग को हेल्प चाहिए होगी ना, उसकी पूरी प्रोटोकॉल बनानी होगी कि उसको कहाँ से परचेज करना है, कैसे क्लाइमेट में रखना है, फिर उसका कैसे।
तो मतलब पूरा स्टडी करना पड़ेगा, जैसे आप एग्रीकल्चर पढ़ते हैं उसी तरीके से लीच का भी पहले पढ़ना पड़ेगा, समझना पड़ेगा, उसके बाद ही आप प्रोटोकॉल डाल सकते हैं। और फिर ऐसा नहीं है, इसके लिए मैन पावर लगेगा ना, क्योंकि आप जैसे एनिमल हाउस के लिए मैन पावर लगेगा, इसको भी कल्टीवेट करने के लिए मैन पावर लगेगा ना।
यस।
तो कर सकते हैं, अगर आप देखिए, अगर आपके पास ऐसा है तो आप गवर्नमेंट को एक प्रोटोकॉल दे सकते हैं, जाके आप जैसा ट्रेनिंग होती है उसके तरीके से इसकी भी ट्रेनिंग, जैसे हॉर्टिकल्चर की ट्रेनिंग होती है इसकी भी ट्रेनिंग होती होगी, तो आप ट्रेनिंग लेके खुद खोल सकते हैं, और ये अच्छा बिजनेस है। क्योंकि अभी लीज 200 250 में एक लीज मिल रही है, और वो भी कैसे, हम 2 या 3 सिटिंग से ज्यादा नहीं दे पाते, इसके बाद वो लीज इफेक्टिव ही नहीं रहती है। और अभी जो कोलीग हमारे हैदराबाद में कर रहे हैं लीज पर काम, मतलब उनका पूरा बिजनेस ही लीज पर है, तो वो तो कहते हैं कि एक ही बार लगाओ बस, नेक्स्ट टाइम नहीं लीच लो आप, क्योंकि लीच कई महीने तक भुक्के रह सकती है। या सेम लीच अगर आप 1 वीक के बाद लगाएंगे तो उसका इफेक्ट उतना नहीं आएगा। उनका ये बोलना है कि लीच जब तक, मतलब जब तक वो हंगरी नहीं रहती है, वो मतलब ब्लड सक ही नहीं करती है। लेकिन हमने तो सेम लीच यूज किया, क्योंकि अवेलेबिलिटी नहीं है यहाँ पर लीच की। तो 4 6 7 पेशेंट में हमने किया, उसके बाद लीच मिलना बंद हो गए, तो हमारा ट्रीटमेंट भी बंद हो गया। फिर हमने कई वेंडर से, फिर शिवाजी नगर से वेंडर से फिर हमने लीच मंगाया, लेकिन वो पोर्टल ला के लीच देना, फिर जब तक पेशेंट वेट करना, ये सब इश्यूज आ रहे हैं, लेकिन रिस्पॉन्स बहुत अच्छा है। और पेशेंट कंसीव हो रहे, सबसे इम्पोर्टेंट जो पेशेंट्स को डिप्रेशन, क्वालिटी ऑफ लाइफ पुअर थी, और पेन जिसको था, मतलब वेग पेन, यहाँ ही सिर्फ डिस्मेनोरिक पेन, बट के जो वेग पेन था मंथ में, वो पेन भी कम हो गया था, कि बैक एक भी कम हो गया था पेशेंट का। और अभी
मैम और जी
हैदराबाद में तो
मैम।
सिर्फ लीच थेरेपी दे रहे, वो तो ओरल कोई मेडिकेशन भी नहीं दे रहे, सिर्फ लीच थेरेपी दे रहे प्री मिनिस्ट्रली, तो भी रिस्पॉन्स आ रहा है। हमने तो भी मल्टीपल थेरेपीज दिया था, ओरल दिया, लोकल दिया, फिर लीच थेरेपी दिया। वो लोग सिर्फ लीच थेरेपी दे रहे प्री मिनिस्ट्रली, सिर्फ 1 साइकिल प्री मिनिस्ट्रली दे रहे, उससे भी उनका डिस्मेनोरिया कम हो गया।
थैंक यू मैम। मैम जैसे आपने स्किन में भी बहुत सारे, टीनिया में बहुत अच्छा रिजल्ट है इसका, और ऑस्टियोआर्थराइटिस में भी बहुत अच्छा इसका
वही बता रही हूँ,
रिजल्ट है।
लीच लीच का रिस्पॉन्स अच्छा है, हमको लीच अवेलेबिलिटी मुश्किल होगी ना।
लेकिन लीच अवेलेबिलिटी हर जगह पूरे इंडिया में ही तकरीबन तकरीबन प्रॉब्लम है इसकी, लीच अवेलेबिलिटी की।
जी, तो इसके लिए फिर हम गवर्नमेंट से aid लेके, जिस तरीके से हम एनिमल हाउस मेंटेन करते, उस तरीके से आयुर्वेद और यूनानी कॉलेज में लीच के लिए भी हमको, जैसे एनिमल हाउस को जितना हम केयर करते हैं उतना केयर लेके हम बना सकते हैं लीच बैंक। कम से कम चलिए 100 लीच हम वो करेंगे तो 50 तो काम में आएंगे। और मतलब नेशनल इंस्टीट्यूट्स तो कर ही सकते हैं, उनके पास स्पेस की
यस
कमी नहीं।
मैम।
एक्चुअली मैं गायनिक डिपार्टमेंट से हूँ, इलाज भी तदबीर से नहीं हूँ, तो जितना मेरे उसमें मैं कर रही हूँ।
जी मैम।
और किसी का कोई प्रश्न? मैडम ऐसा नहीं हो सकता कि हर इंस्टीट्यूट इसका दायित्व ले ले, बड़ा बड़ा,
वही
और
वही
वही लोग कल्टीवेट,
जी, वही वो लोग
है
ही
ना?
हाँ कर सकते हैं ना सर, वही तो बता रही हूँ मैं, जिस तरीके से हम आयुर्वेद में देख रहे हैं सर, बहुत सारे एमओयूज कर रहे हैं, बहुत सारे लोग दूसरे डिपार्टमेंट्स की हेल्प ले रहे हैं, दूसरे इंस्टीट्यूट की हेल्प ले रहे हैं, इस तरीके से हम एनिमल एनिमल जो नेशनल इंस्टीट्यूट है जहाँ पर ये देखे जाते हैं एनिमल्स, उनसे भी ले सकते हैं ना हेल्प। क्योंकि आप देखिए 200 300 में एक लीच है, अगर हम उसको करेंगे तो लीच की कॉस्ट कम होगी, तो पेशेंट्स को एफोर्डेबिलिटी बढ़ जाएगी।
जी, बिल्कुल ठीक बोले।
Pawanji, when we are if I can I say something, Pawanji?
जी बिल्कुल 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 जी।
Yes. So I share just my experience that when we are talking about the leech and business, and then and then availability. So this was the topic which I heard now. So I wanted to make a comment like this, that in Germany, my students and my colleagues, so they are using really leech therapy in the, it's officially approved, medically approved by the state in Germany and also by EU. And then we see that in plastic surgery and reconstructive surgery,
Yes, I have gone through the
course,
paper.
osteoarthritis is one of the best, and then all skin disorders. But in plastic surgery and reconstructive surgery, one of my students is also a very renowned plastic surgeon in Germany, in Hanover, and he's really using it, and he shares his experience with me. So I must say that this is a really upcoming science, and if I understand correctly, for my colleagues in Unani medicine from Delhi University, because I studied from Ayurveda, and I see a lot of names as the Unani names or Muslim names. So on the screen, that's why I mentioned that I'm a graduate from Delhi University, Ayurveda and Unani Tibia College in 1983. So that's why I can say that when I talk to my colleagues, so absolutely, I never saw any leech therapy in our college during our internship, during our college days, during our house surgeonships. That is already 1983. I'm talking, so that means 42 years ago. But I don't know now if this is existing or not. But this is a very very good science. And Rakt Mokshana is our Sushruta based therapy, and and I understand from Unani medicine it's very important. Like you call soda, so Khun is the soda, one of the four soda. Like we take three doshas, and this is how I understand. So I think this is the upcoming science, and it should be projected in a good way. The only thing is that, like one of the participant here was mentioning about, asking about the protocols. So the government of India, Ayush department should set up very clean protocols so that the highest quality leech can be obtained, and for the right therapy.
Correct, sir.
I can only say that.
I agree with you, sir. Because 1983, I think so. This regimental therapies or panchkarma, all this came within 10 years back, sir. Previously, no one was knowing all this thing.
Yes, yes.
Very,
In our college, in fact, me after passing, after so many years, I was the one who helped the Panchkarma department to settle in Delhi. So I know that it is not nowadays. It's upcoming. It's upcoming.
very
So there is a lot of possibilities now in Hirudotherapy, and Ayush department must some of you must contact. Some of my colleagues are also on this platform at IRES, who was my class fellows and junior seniors, who were dean and principal at my college. And so you can contact the Ayush department, and you should push them. They should do that. There is no reason to request them. There is now no reason to request. Just to say to them what you require, and they have to do that. If they don't do that, just make a complaint to the health minister. That's it. No, in between. The bureaucrats are babus. They have to work for us. They are not the boss, they are babus. So we have to, otherwise just make a representation to the Ayush ministry, to the Unani director or advisor, and then he has to do that. Otherwise you contact the minister for that. This is what we should do, I think.
correct, sir. I agree with you, sir. And because this suddenly, because incidence of endometriosis is increasing day by day, and the treatment is again hormonal and surgical, patients are not affordable. Most important thing is that. And if we
So
can,
the government of India should provide it, because it is, they are saying about so many insurance schemes and all this. So Gov India should provide all the facilities in the hospitals in Delhi or in elsewhere all over India, Ayush hospitals. They should provide a department of surgery which should have an hirudotherapy department, a sub department, and it should be financed very very well. Why the people have to pay for that? And for here, because you are discussing about 200, 300 rupees. So if I say to you, nobody will touch a patient here below 500 euro, that means 50,000 rupees. So there is no question about comparing these things. So the government India should provide that.
Yes.
Good. Thank you very much. Thank you, Dr. G, and for listening to you. And I take my words. I take silent. Thank you. Thank you. Thank you.
Thank you, Navinji. Thank you. Whether leech therapy is allowed in whole Europe?
Yes, it is allowed. It is allowed, but not by me. I cannot do that. I cannot do that. Not by me. I'm not a medicine. I don't have a medical license to do that. So you must have a medical license. But since my all students are in UK, you know that all students are FRCS from Royal Colleges. So if I take one of them besides me, I can do that. But I've not started any department. I would like to do that with some of my friends here. I would like to do that. In fact, I introduced you last time Professor Yashpal Gupta from AIMS, Delhi, from 1970s graduate. He's one of the top plastic surgeon of the world from Harvard and from London. So I want to start hirudotherapy in London here. So this is my answer to you, sir. Yes, it is allowed.
Thank you. Thank you. Thank you very much. Any value addition? Any suggestion? Any question from anybody? आदरणीय सीपी शर्मा सर तक मेरी आवाज जा रही है? आदरणीय डॉक्टर सीपी शर्मा सर।
जी सर, जी सर।
प्रणाम सर, प्रणाम सर। आपके
हाँ,
ओजस्वी कंक्लूडिंग रिमार्क्स सर। इसके बाद अपन दूसरी वेबिनार शुरू
जी
करेंगे कि
सर, सर।
स्टूडेंट और टीचर के कोऑर्डिनेशन कैसे रहे।
ओके सर। अभी मैडम का जो लीच थेरेपी हमारे यहाँ सर शल्य चिकित्सा में शस्त्र और अनुशस्त्र जो हमारी अ, यवा यवा लीच और इस तरह का आजकल जो सक्शन द्वारा चल रहा है ना सर, श्रृंग के माध्यम से और अला
हिजामा
अलाबू अलाबू जो कड़वी तोरवी से बनता था, टुंडी जैसा, ये सब हमारे आयुर्वेद में एक्सप्लेन्ड है और उनका दोषानुसार कि किस दोष में किसका प्रयोग श्रृंग का कहाँ करना है और लीच का कहाँ करना है, इसका अच्छा वर्णन, सैद्धांतिक वर्णन आचार्य सुश्रुत ने किया है शल्य में। अब बात आती है सर किसी भी विधा को, जैसे मॉडर्न में शल्य डिपार्टमेंट में पहले सर्जरी एक हुआ करती थी, अब वो सर्जरी में देखिए आप कितनी सर्जरी, ईच एंड एवरी सेगमेंट हैविंग मेडिसिन, मेडिकल ब्रांच एंड सर्जिकल ब्रांच, और उसमें भी माइक्रो सर्जरी, न्यूरो में भी देखिए डे बाय डे। तो ऐसे ही हमारी जितनी चिकित्सा की व्यवस्था है उन व्यवस्थाओं में इन शल्य में अभी एनोरेक्टल के ऊपर बहुत जोर दिया जा रहा है, भारत सरकार भी पंचकर्मा और एनोरेक्टल के लिए फाइनेंशियली सपोर्ट, तो हमें इसके लिए लीज थेरेपी के लिए भारत सरकार से, प्रदेश सरकारों से और एनजीओज के माध्यम से भी, हमारे कुछ एनजीओज भी हमें सपोर्ट करेंगे। जैसे सुल्ताना जी ने बताया कि भाई लीच की वास्तव में, तो नागपुर से भी मैडम लीच आती हैं, कुछ नागपुर वाले भी कुछ सप्लाई करते हैं।
जी सर।
उसमें इसमें केवल ये है कि थोड़ा सा इसमें हमें वेटनरी और एग्रीकल्चर
जी
इन
सर।
दो डिपार्टमेंटों के साथ एमओयू करके और आयुर्वेद को उसमें वो करना पड़ेगा, पहल करना पड़ेगी, हम लोगों की पहल होगी कि हम उसकी यूटिलिटी और उसका, जैसे गाँव में जो पानी भर जाता है, इनको हम लोग कहते हैं गड्ढे रहते हैं, पोखर कहते हैं, उनमें लीच पाई जाती है, वो पॉइजनस रहती है, तो वहां वो कितनी ग्रो कर जाती हैं, कई बार वहां पे जानवर जाता है ना उसमें पानी पीने तो उससे चिपक जाती है। अब केवल और केवल हमारा पॉइजनस, नॉन पॉइजनस और मेडिकल मेडिकल हमारी सर्जिकल पॉइंट ऑफ व्यू से कौन सी उपयोगी है, उसी को हम तैयार करें। और शासन से शासन तो बहुत ज्यादा कब सोचता है, जब उसको ये लगता है ना कि जब विदेशों में बहुत ज्यादा उपयोग होने लगता है तो फिर वो सोचता है यहाँ पर इंडिया में। और हमारे जो शल्य में हमारा दुर्भाग्य क्या रहता है मैडम, कि जो विभागीय एक्सटेंशन है, विस्तार है, वो विस्तार न होके हमारे डिपार्टमेंट और सिकुड़ते जा रहे हैं।
जी
पूरा शल्य डिपार्टमेंट केवल पाइल्स फिस्टुला पर ही फोकस करे बैठा है। पूरा पाइल्स फिस्टुला, एनोरेक्टल, एनोरा और जो पंचकर्म, अब पंचकर्म को भी अपन कितना बढ़ा सकते हैं, उसमें भी हमारा डर्मा में इसका बहुत बड़ा उपयोग हो सकता है। जितने भी डर्मा के डिसऑर्डर्स हैं, तो हमारा पूरा का पूरा मेडिसिन डिपार्टमेंट से एक डर्मेटोलॉजी के ऊपर, डर्मा के ऊपर भी वो बन सकता है, जिसमें ब्लीच हमारे लिए बहुत उपयोगी सिद्ध हो सकती है। आपने जिस संघर्ष और पूरे साइंटिफिक अप्रोच से इसका एप्लीकेशन किया, वह निश्चित ही सराहनीय है और हमारे आगे आने वाले छात्रों के लिए एक उत्साहवर्धक पहल है, जिसमें आयुर्वेद, यूनानी और आयुष डिपार्टमेंट के लिए अच्छे सुखद परिणाम आएंगे और हमारे छात्र अच्छी प्रैक्टिस कर पाएंगे अपने विधा के माध्यम से। आप जैसे